So now you're doing fill us in.
Group health.
Yep.
Yep.
And it's group health, but it's also ancillary. Tell me a little bit more about Champ.
Yeah. So, sorry. So we focus mainly on group health. Like that's the foundation of who we are at AffordaCare, right?
Yep.
But we have this plan called the Champ plan that's just an absolute game changer. So that plan is a net win for everybody involved, the employee, the employer. It gives the employees better benefits, keeps them healthy. I mean, there's so many different things it does. So much like I did at my previous career, I focused on agent development and organizational development because I saw a weak spot in that nobody else was focused on that. They were just focusing on the sales, right? Numbers, numbers, numbers. Well, whenever I came over to AffordaCare, I noticed nobody was really paying attention to this Champ plan that I thought was just an absolute game changer.
Sure.
So I just dug in deep and made myself the expert on that plan so that we could get it out to the masses.
Well, that's how you and I connected because I've known your colleague, Stephen Guilfoyle. I love that guy. I love everything about your guys' group, Champ included. Obviously, I know those guys as well because I'm a part of Champ. We have been for a year now. But between you and Steve and your whole crew, I've really developed friendships with you guys. And I think those friendships are based around just a mutual trust and respect of just we're all hustlers. We're all trying to get this stuff done. So it took, one of the things that was funny is when you first presented Champ to me and my business, we have 50 employees. I was listening and I was paying attention, but it just was like too good to be true. So you're telling me that my employees can get more benefits. You're telling me that they can make more money, it not cost them money. You're telling me that as an employer, there's incentives there as well. And you're telling me that I can roll this out for really not that much more than just gathering a census.
Yep.
So I didn't even take action on that for probably 5 months. Isn't that crazy?
Yeah. Yep.
So then,
but not uncommon.
Yeah. So then it took me. So then finally, I'm like, I don't know what actually clicked, but I think you were finally like, dude, just give me your dang census. And I'm like, okay, fine. So then we did it. They rolled it out to our employees, and we had 100% participation. Everything happened like you said it would. And then about 6 months after I rolled it out, I hired a accounting firm, or I told my accounting firm to bill me for doing a full audit on all of the premiums and all of the discounts and everything. And I said, here's the number that they said I would be at. I need you to tell me if I'm at that number or not. So the accounting firm did their due diligence. They came back and said, yep, everything's fine. My CPA's bill didn't change because it's a one-time adjustment on my employees' pay stub. So it's not like it cost me more to implement the Champ. But more importantly, guys, I was able to, it counts as MEC, right?
Yep.
Okay. So just want to make sure that before I said that, it allows me to offer health insurance day one for recruiting salespeople. That helps a lot because when you offer health insurance day one, it allows you to get into certain job boards at a higher sort of priority than other places. So not only is the house winning, my employees are winning, they're getting healthier, but on the recruiting side, it allows me to give a opportunity to offer health insurance day one. Now it's catastrophic coverage. It's not a general group plan that would be considered catastrophic, correct?
Not necessarily catastrophic, but more limited medical benefit plan.
Okay.
Yeah.
I'm no expert. I just rolled it out. You're the guy.
Yep.
So why don't you speak to us like we're kindergartners and give your perspective of the Champ real quick, and then who's a good fit for the Champ for being a broker or whatever. Tell us about that a little bit.
Yeah. So the broad stroke of the plan is the whole intent of it is to, I guess, disrupt the insurance world or change the way people view their health. Right. So being in insurance, everything that we sell is reactionary. You get sick, you go to the doctor, you use your insurance. Someone dies, they use their insurance. There's been nothing on a proactive side to keep people healthy and lower their risk categories and keep them from having to go to the doctor and use their insurance so much. So that's the whole purpose of the plan, is to keep people in a lower risk category health-wise, get them focusing on their health more through not a time-invasive activity, right? That they're spending 5 to 10 minutes a month within the platform getting healthier. In turn, they see an increase in their take-home pay, and they get some limited medical benefits along with it, like zero copay office visits, zero copay urgent care, prescriptions, direct primary care, which is virtual office visits. There's a lot of positives to it, But the purpose is, again, incentivizing people to focus on their health and kind of disrupt the way that the healthcare industry has been viewed as a whole.
Sure. Well, I can tell you right now, it has really helped my business be able to offer a benefit, one of the benefits that I think is helpful. And so that's been really cool.